Hi, good evening. How's everybody? Survived the weather of this afternoon, that's good. So I'm Diane Kresh, and I'm the director of Arlington Public Library, and this is our third evening of the library's first ever Health Week, which is focusing on a different theme each day, from the brain and family health to heart and mental health. And we're connecting our community with the resources they need for optimal well-being. It's my privilege to welcome you to tonight's panel discussion, Mental Wellness from A to Z, an open and honest conversation about mental health with our partners, the Department of Human Services, RAFT or RAFT, and the National Association on Mental Illness. Thank you all for being here and being part of this really important conversation. And thank you to the organizations who participated in our resource fair. Representatives will be available after the event to answer questions, and when it comes to mental health, the library plays an important role both in promoting general well-being and as part of a support network for people struggling with poor mental health. We do this by providing safe and welcoming spaces, through reducing barriers to information access, and by developing programs like this one that address the needs of our community. As you know, the library is often people's first point of entry into our community. We take great care to ensure that everyone feels welcome in our spaces and has access to our programs and services. We do this through our policies and with our partners and by the training we provide our first-rate staff, and we often do a lot of that training with DHS. The library is also a safe place to ask questions. While there are plenty of resources available on the internet, searching for them can be daunting. For example, when one types mental health into Google, one retrieves, guess, how many results? 1 billion! Further, the accuracy and the biases of the websites are not often apparent, which is why we need librarians to help users sift through the content and keep patrons from being led astray by sources that are either inaccurate or potentially harmful. By speaking openly about mental wellness, as we are doing here tonight, we are hoping to change attitudes and assumptions about individuals living with mental health conditions. As someone who herself has suffered from anxiety and depression for most of my life, I can attest to the value of shining a spotlight on mental health with the hope that by so doing, we can not only increase the resources dedicated to effective management of those conditions, but we can build more compassion and understanding in our community for those living with mental illness. Libraries are not diagnosticians. We do not have all the answers, but we can help you ask the right questions, because the right health questions will lead to better health care for everyone. And with that, it's my pleasure to welcome tonight's moderator, Alex Geller, Arlington Public Library's Programs and Partnerships Librarian. Thank you, Alex.
Thank you. So there are many views and opinions about mental health, but what is certain is that we all have it. Mental health affects how we think, how we act, how we relate to people, how we deal with daily stresses. And mental health is important at every stage of life, from children, adolescents, all the way to adults and seniors. The other thing we need to be aware of is that mental health problems affect nearly every family. This year, 1 in 5 adults will have a mental health problem. Misperceptions, fear of social consequences, discomfort associated with talking about these issues openly, and discrimination all tend to keep people silent. With the understanding that mental health is not due to weak will or just a bad mood we can switch on and off, we have a panel here of clinicians and experts and people with lived experience discussing this matter openly, honestly, with intellectual honesty and empathy. So let's go around briefly and introduce ourselves, starting with Lynn.
Good evening. My name is Lynn Ngay. I'm the Prevention Director for the Community Services Board for Arlington County Government.
Good evening. Thank you. Good evening, Jamie Premdas. I am the Children's Behavioral Health Bureau Chief with the Community Services Board, and I oversee our treatment program, prevention in our Child Advocacy Center.
Good evening. I'm John Palmieri. I'm the Division Chief for Behavioral Health Services for Arlington County, CSB, and that's primarily working with adults with mental health and substance use disorders.
I'm Nora Johnston. I'm a therapist with Senior Adult Mental Health.
Hi, good evening. I'm Alice Straker. I'm the director of the RAFT program, which stands for the Regional Older Adults Facilities Mental Health Support Team. And we are a regional program, and we collaborate with all 5 CSBs in Northern Virginia to help older adults be discharged from state psychiatric hospitals and help prevent rehospitalizations. And we do that through providing lots of training and education as well as direct mental health services for people who work in long-term care facilities.
Hi, I'm Elizabeth Shook. I'm the Wellness and Recovery Manager with the Behavioral Health Care Division and the CSB here in Arlington County.
Hello, I'm Melissa McCox. I'm a volunteer with NAMI Northern Virginia, speaking about my lived experience with a mental health condition for the In Our Own Voice program.
Thank you very much. So we're going to try something different than a normal panel discussion for this evening. What we're going to do is intermix Mellie's personal lived experience dealing with the mental health condition from when it was diagnosed to how she's lived with it and how it's affected her life and treatment, followed by discussion between our panelists on how mental health can affect all of us at any time. So without further ado, Mellie, take it away.
Just thought I'd introduce myself a little bit more. I'm Mellie Cox. I've been living in the Arlington area for 13 years, just until last year when I moved to Maryland. I like Arlington so much that I was really pleased to come back and visit the library. Right now, I have a home in Kensington, Maryland, and I'm married and I live with my husband and my son. I work in higher education administration in Washington, D.C. And I wanted to start out by saying that I'm not an expert in health or mental health. I'm not a professional. I'm just a person who's living with a mental health condition, and I can only speak to my lived experience, and hopefully some of these other experts can provide a more professional view. For me, the symptoms began when I was 21 years old. I had just graduated from college and was living in France. It started by not being able to get out of bed. I wasn't hungry, I couldn't sleep, yet I just wanted to stay in my bed. I didn't know what was happening to me, and I didn't understand why I could not control it. I had everything going for me. I had just graduated from college, I had a loving family, and had a great job. Why couldn't I just will myself to be happy? I didn't ask for help because I didn't think I had a problem. But I couldn't deny what I was feeling. I'd had a failed relationship in college, and I started to have feelings that this person was going to find me and kill me. I was having a paranoid delusion. I didn't tell anybody about this because I didn't trust anyone. Fortunately, my parents picked up on my constant crying, and they rushed me back to the United States. And 9 days after I turned 22, I saw my first therapist. And I was given a series of questionnaires and tests, and I was diagnosed with major depression and schizoaffective disorder.
Thank you. So, Mellie taps into this persistent challenge we face when talking about mental illness. Because the subject of mental health is often avoided or silenced, because it's personal and internal, and because it's often treated as a failure, like a personal failure. And it becomes difficult to effectively promote mental health and prevent mental illness when all of this is apparent. So I want to turn to the panelists right now. We're going to start by focusing on the challenges that people face and the factors we should consider that have the greatest influence on mental health, particularly those that affect young children. So we're going to start with Lynn.
Okay, thank you, Alex. I'll start and the panel can chime in as well. I want to add to your important points, Alex, about mental health stigma, and then answer your question about mental health prevention issues, especially with children and youth. Public stigma is a pervasive barrier that prevents many individuals in the U.S. from engaging in mental health care. In a recent meta-analysis study by NIH, 39 journal articles on stigma were reviewed. What they found had many implications on our work. Number one, the conception that individuals with mental illness is dangerous has not decreased over time. So this is over a period of about 30 years of peer review articles that they looked at. So what this tells us is that the media needs to resist portraying acts of violence in causal relationships with a mental illness. Number two, they found two effective interventions to work against stigmas. Number one, strategies that incorporate entertainment or education, for example, TV shows, trainings that involve avatar training, which one of them I'll talk about later. And then the second one is positive contact with person with mental illness, and NAMI does a lot of work on that. So with regard to children and youth in Arlington, from a 2017 Youth Risk Behavior Survey, what we have is that 1 in 5 middle schoolers and 1 in 3 high schoolers report feeling sad or hopeless for a period of 2 weeks in the last year. 1 in 5 of these students said that they considered suicide. Among these students, more than half reached out to family members, friends, or counselors and therapists. It makes you think of what the other half do if they reach out to anyone at all. Those are opportunities for prevention and outreach for us. So given that stigma is a barrier to mental health awareness and help-seeking behavior, and the prevalence of mental health concerns in our youth, here's what DHS's prevention services is doing to address these concerns. We are implementing programs to promote positive youth development through classes, presentations, and resource fairs and campaigns. Our wellness programs are guided by principles of equity, inclusion, and based on approaches or constructs of trauma-informed care, protective factors, and resiliency. 2 such programs that we implement are ACEs, which are Adverse Childhood Experiences, and also Youth Thrive. We help families understand, one, the importance of mental wellness in children. It's never too early to talk to children about mental health. The importance of developing positive ways to cope with stress, and the importance of developing protective factors to mitigate the impact of trauma and stress, such as having trusting and consistent adults to connect to, right? So some of our programs include, and I'll be happy to talk further in detail at the end, should you choose, is tabling events and health fairs. Every year we engage on a one-on-one basis with about 6,000 plus individuals in our county. We have a Cognito program called Cognito with a K, and that's an avatar online training program that teaches adults who work with high schoolers and middle schoolers, and also there's a program called Step In Speak Up for LGBTQ communities that helps you raise your awareness of signs and symptoms of mental distress, signs and symptoms of suicide, and how to link them to services. And this past year alone, we helped APS, Arlington Public Schools, train 2,000 of their staff on this program. Mental health first aid training. Every year we train about 350 individuals in our county. That's an 8-hour evidence-based training. And lastly, we have a program called Strengthening Families that engages directly with children and their families for 7 weeks, 3 hours a week, that teach parenting skills and relationship building. Okay, well, with that, I yield my time. Too much C-SPAN, sorry.
You want to add something? Okay.
You were pretty thorough.
Oh, yeah, that was great. Thank you very much. So, yeah, absolutely, go on.
Just a couple of words that I just wanted to add on to what Lynn said. I think he covered things pretty comprehensively, but one of the things that I heard when Melly was speaking was really that self-blame and guilt, which I think really reflects the stigma that Lynn was discussing. And I think one of the issues that also we need to discuss is really sort of the language and the discourse that happens kind of at the national level, or in terms of how we talk about mental illness and how we talk about substance use disorders, And I think that that's profoundly damaging to people who experience these challenges, and it really, I think, contributes to this internal shame and guilt and self-blame because there's not really a public forum that's very accepting of mental illness and of substance use disorders. So I think that's something that it's a harder thing to change, but I think it's really important that we pay attention to the language that we're using and provide opportunities for people to have kind of mental health check-ins regularly so that we kind of know where people are at any given time, knowing what the risk factors are, whether that's some of the things that Lynn talked about in terms of social determinants of health, trauma, poverty, housing instability, family history, other things that we know place people at risk, really having opportunities to check in with youth and even adults as they age to make sure that there aren't any issues that really need to be addressed.
I mean, what both of you point on and what Melly lucked into is that her family reached out to her and helped care. And you said only 50% of kids actually reach out to their family. I mean, so those are the lucky ones.
Exactly.
And this is why conversations like this are so important, so that we can come together, not only individually, but as a community, and know that not anyone has to suffer this alone. So, Melly, let's return to you. So, you returned home, you received your diagnosis. So, what seemed to help?
All right. After I received my diagnosis, I was given an antidepressant and an antipsychotic medication. And the first one I was given did not work right away, and several didn't work right away. It took some time to find the right combination of medicines. But once I did, the delusions vanished, and my mood stabilized. But it took me years to recover emotionally, and a big part of that was therapy. I immigrated to the United States when I was 13. And it was a turning point in my life in terms of my emotional and social growth because I completely turned within myself and I had trouble making friends. I didn't have a social network. It might have appeared as though I was a normal teenager, but I was extremely socially isolated. And so I didn't think that I had anybody I could talk to. And so when I was presented the opportunity to speak to a therapist, I took the opportunity and I started going to therapy twice a week. The therapy was like an education for me. I realized that a lot of my belief systems and my thinking patterns were wrong, and they were actually making me sick. And this is part of something else that I learned about anxiety, is that thinking patterns can be interrupted and changed so that your mood improves. One of the things I had a lot of trouble with the medicines, even though they worked, was I had trouble accepting my dependence on them because I thought that dependence was bad. I didn't want to have to depend on something for the rest of my life. But I got a very important lesson on that from my therapist who was blind. She had learned to read and to do all her studies through books on tape, Braille. She had a seeing eye dog, she had a driver, and she told me, look, I cannot see. I can't even pick out my own clothes. I have to have somebody drive me. I depend on this dog. And because I can accept this dependency, I'm able to be a functioning therapist. And so that really helped me understand that it was okay for me to also accept my condition and to take my medicine.
Thank you very much. What's clear from this conversation so far is that your own personal attitudes and beliefs really can shape how you actually pursue your own mental health treatment and self-care. And in treatment, there are promises made, there are pauses taken, there are false starts. Sometimes it works, sometimes it doesn't, sometimes the medication is appropriate, sometimes it's not. Even people with the same diagnosis will have different experience, needs, goals, objectives. So speaking about Arlington specifically, and then we'll broaden it out, what resources are available here in Arlington County for people who are seeking treatment? And what would one expect if they're actually meeting with the clinician?
Sure. So in children's behavioral health, we work with children 3 to 17, and we offer services for all Arlington County residents. We have same-day access, which means that on specific dates or specific days and times, families are able to walk in with their children and receive an intake that day. And if they are eligible for services, they are connected with a service provider. So it's really awesome. They don't have to call and make an appointment. They really just have to come in. We do have a line that families are able to call if they have questions, but really they can just walk in with their kids and be seen that same day. And we don't have a long wait time either, so that's also really positive. In children's behavioral health, once a family comes in, they meet with our clinician, they can expect to be told what services would look like for them, what services our clinician recommends based on what is happening with the child and with the family, but also what services are the family and child interested in pursuing, and which services are they ready to have and engage in. And there's some services they might want to start with right away and other ones that they might want to wait on. And so we work with kids that have mental health needs as well as substance use needs. We do therapy, individual, family, group. Whether you enter into family or group really is determined by what is appropriate, what the needs are, and what the client feels comfortable doing. We also have several evidence-based models that are trauma-informed, and all of our clinicians are trained to work with children and families that have experienced adverse childhood experiences, the ACEs that Lynn mentioned. We have case management. So some families need more intensive services. Some families, children have complex needs, need assistance with navigating community-based resources. There's multiple systems involved. So our case managers are clinicians that can really help families link with those outside resources. So they can have therapy, they can have case management, and we have a psychiatrist as well.
So I will speak a bit about the adult services. I'm going off script a little bit. If just give me a minute, I'm sorry. So I just wanted to highlight, thanks, Lynn. Something that Jamie said about people coming in for services and what they can expect. And really, this is about a shared decision-making practice. So this is really about what the client is coming in wanting to do, what they might not be willing to do. But this is a collaborative endeavor. This isn't really about somebody coming in and us telling them, these are our recommendations and this is what you have to do. This is really about what somebody's goals are. There might be things that they want to work on that are priorities for them, and then things that they don't want to work on, at least not right now. And that's totally fine. And that's really a conversation that a client would have coming in the front door to talk about what their goals are. That might include medication. It might not include medication. It might include specific types of medications or concerns about certain medication side effects. And that's, again, all part of the shared decision-making process, which really is about people having autonomy and managing their conditions in the way that's individualized and personal. And not, I know Melly talked about the dependency, but for me, it's really about clients choosing to manage conditions in a way that feels right for them. And that's really, I think, what people can expect. In terms of services that we offer, it's pretty similar to what Jamie mentioned for child services. We have same-day access as well, so people can walk in Monday through Friday requesting to speak with a clinician to talk about what their needs are. We have pretty what people would consider traditional sort of outpatient services, therapy, case management. We have 24/7 emergency services, so even when our same-day access folks aren't available, if there's a crisis or urgency, then people need to speak to somebody right away, day or night. There's somebody available to do that. We have a lot of specialized services that work with people who are not housed or homeless, street outreach programs, people who are justice involved. As many of you know, a lot of folks struggling with mental health concerns end up in the justice system or incarcerated, and so we have a lot of services working with those individuals to try to get them out of incarceration and out of the justice system. We have assertive community treatment. Our esteemed manager of that program is here in the audience, and that's really a 24/7 program, really without walls, provides intensive services in the community for individuals who are at high risk for hospitalization, psychosocial rehabilitation, skill building for people with vocational goals, social goals, other sorts of goals that they might have to kind of help them develop skills to meet the goals that they have or the functional goals that they have. Medication services, as Jamie said, and then a range of services both for people with mental health conditions, substance use disorders. People often have both. We have folks who can work with people with co-occurring disorders, and then we have contracts with a range of other services outside of the clinic setting, including residential programs, detox, crisis stabilization programs, that sort of thing.
I just wanted to mention two things that we have related to some recovery services. We have peer recovery specialists, and they are, well, we have both full-time permanent positions and some part-time positions. They're individuals with lived experience who are part of a team. They help to complement a treatment team, and they work with individuals, they themselves have substance use or mental health challenges, and they use that lived experience to help engage with clients. They do, their work is really in a very different specialized way that, like I said, complements the treatment team. We also have a contract with the peer-run recovery center, and it's open 4 days a week from 10 to 3, and it's run by people who have lived experience with mental health and substance use challenges.
I did want to say a few words about the RAFT program because we are a little different than a lot of the services available in Arlington County. Because we are a regional program, we partner with all 5 counties in Northern Virginia, including Arlington County, that when older adults are hospitalized, especially at state psychiatric hospitals, we support their discharge to long-term care facilities. And as everybody on this panel has mentioned and knows, when people have a psychiatric diagnosis, there are many doors that are closed to them, including admission to long-term care facilities. And so one of our jobs is to help facilitate their discharge and provide ongoing mental health services so that people can remain in their home, close to their families, and don't have to be rehospitalized. And so we do have many Arlington clients we work with who live and thrive right here in Arlington County.
Yeah, so I just wanted to say with senior adult mental health, we have a similar same-day access where you don't need to have an appointment. You come in. It's for people that are 60 and over with a severe mental illness such as bipolar disorder, major depression, schizophrenia, and we can provide therapy, case management, and psychiatric services. One thing I wanted to mention is that if you do not qualify for our services, we don't just send you away. We will help you connect to the right resource. So if you have depression but not major depression, we would say, well, let's help you find a therapist in the community and get you the help that you need. And we make sure that happens before you leave, and we also follow up with you as much as you need.
Thank you very much. But before we turn to Melly, just listening to her story, it's so brave to just speak openly about this. And it'd be really disingenuous for me not to also then talk about my own experience with the group. My sister's here. She's right over there. So she takes part in this story. When I was 22, 1 year out of college, I grew up. I was really happy as a kid. I graduated college debt-free. I was really lucky, so I didn't really have these stressors that a lot of people in my generation faced. The woman I was seeing was killed while I was at work, and I didn't know how to handle it, and I immediately quit my job, which is not the best thing to do. Because I had no experience dealing with mental health. My sister actually left her job and came and found me and took care of me. And then I spent 4 months trying to white knuckle it because I had no experience or background and had no resources to turn to because I didn't have a therapist. I didn't even think mental health was really a thing to deal with because I was perfectly happy kid, and this trauma just hit me like a ton of bricks. And then I started grad school, and my advisor was the one who actually told me that I needed to go seek counseling to deal with this trauma and actually speak openly and honestly about how I was handling this. So anybody can do it. It can happen to anybody. I just want to make sure that we can speak openly about it right now and give people the resources so that if the worst were to happen, we can be prepared. So it seems like treatment has been beneficial for you. So where are you on your mental health journey?
My mental health crisis when I was 21 defined my life, but it doesn't define me. I have been managing my mental health condition for more than 20 years, and the truth is I don't even think about it regularly on a daily basis. And I know one of the reasons why is that because I got very early intervention. I only had one psychotic episode, and I have learned that a lot of times the more episodes a person has, the more damaged the brain can become. And I feel lucky that I only had one episode because I've been able to live a full life. And I don't feel as though there's nothing that I cannot do. Yet, I never spoke about it until about 2 years ago when I discovered NAMI and I decided to volunteer because there's so much stigma that I just kept it to myself. It was even a big disclosure when I met my future husband to tell him that I had this condition because it's not something that you really go around advertising. And so when he told me that he accepted me the way I was, it went a long way in helping me accept myself. And that's why I decided to speak openly about my condition because staying silent about mental health is not helping anybody. And so I really enjoy giving these presentations and helping educate people on stigmatizing language and helping people learn about resources because it doesn't have to be stopping your life. It could be a turning point, and in my case, I had a lot of time for self-reflection thanks to my therapy, and it's gone a long way for me being able to lead a fully examined life.
Can you hear me? Is this on? Okay, great. Let's give Melly a round of applause. As Melly shows, recovery takes many forms, and a diagnosis does not have to be devastating news. It can actually sometimes be a relief. Treatment and recovery are ongoing processes. So what does recovery and resiliency actually mean? What does it look like? What can one expect? And once we have this, we'll talk about our main takeaways for this evening.
So, as you alluded to, Alex, recovery really is very different, unique for every individual. And for one person, it might be getting a job. Someone else, it might be having a home, being married, having children. It's just really different for everyone. But whatever individuals want to really live the life that they like to have, I think just like what everyone else wants is pretty much what people who have mental health and substance use challenges want as well. And I think that the other question you wanted to you asked was about resiliency, and I think about kind of bouncing back, and what protective factors, what things do people need to kind of get back on that path to where they want to be? And I think that there's so many different things for that, and people have to work really hard at it. I mean, I think that Melly, you had to work hard. It doesn't just come naturally, and there's so many different things that we have to do, and like what I do in my life that every day that sometimes it feels natural, but not always. But from paying attention to sleep, diet, exercise, things that everybody needs to pay attention to. But I always say that people with mental health challenges, our brains are just a little more sensitive, so we have to pay attention to it even just a little bit more. So I don't know if anyone else wants to kind of chime in with that.
Yeah, I can't help myself. I love to share stories. So we actually work with a woman who is 80 years old, and she lives in an assisted living, not in Arlington, but she is a longtime Arlington client. She has been well known in this area for years, chronically homeless, really a life-threatening leg infection that went unmanaged and because she was homeless and she wasn't interested in treatment and services. So the good news is, fast forward several years, she's been with us 10 years actually. So she was hospitalized at Piedmont State Geriatric Hospital for years, and we supported her discharge. And she was homeless, estranged from her children, really no social connections. But today she is thriving. Her leg, people that know her have said, does she still have her leg? And so she does. She's doing marvelously well. She has reconnected with her son and now has a social connection to family she has never had before. And so for her, that was really a goal that she wanted to accomplish. And she certainly has, and she's thriving.
So with the advent of social media, especially with teens these days, and I mean, there was the It Gets Better campaign, which then sort of fizzled out, I believe. So how can we tell kids that, life after high school, I mean, if people are considering suicide at a higher and higher rate, how can we actually engage with kids those?
Can I chime in with that?
Yeah.
I have a son who's 8 years old, and I try to make mental health an everyday common discussion. He sees me taking my medicines, and I tell him I'm taking medicines because I have an illness in my brain, and this corrects it, just like some people take medicine for diabetes. And another thing that I try to do with him is to make feelings and thoughts be an open discussion, and also talking about them. When he was younger, he had to get some physical therapy for his fine motor skills, and I would casually ask him about his therapy session, what he learned from his therapist, just to try to make the concept of therapy being a normal discussion, because I do know that he might have a genetic predisposition for depression from me. And so if there comes a time where he does need to get therapy, I'm hoping that this strategy will help him be more accepting of therapy and more understanding how common and open mental health conditions are.
I'd like to add a few comments. I think, Melly, that's wonderful that you are speaking to your young son about these issues in an open manner. And I think that's the key for us, is that when we do prevention services or working with families and parents on how to engage young children on mental health issues, it's about the open communication and the ability for the parents to not shy away from it, right? So one example is, and I'll go to the topic of suicide prevention, that we were asked by some local churches to come and speak because there was a recent suicide in the community, and very young kids are asking about it. So 10-year-olds, 9-year-olds are asking, what is suicide? And the parents were very hesitant, and rightly so. They're very ambivalent. Should I talk about this? I think the stigma that some people are still holding on to is, or the myth rather, is that if you talk about suicide, you are planting the idea of suicide in people, and that is simply not true at any age. So in this engagement with the 10-year-olds, we talk about going at the pace of where the child is, right? So if you have a 6, 7, 8-year-old who comes and talks to you about suicide, Mom, what's suicide? Well, Johnny, what does that mean to you? Where did you hear that? What do you think suicide is? And then you begin to talk and disclose information, not ahead of where they are, but just staying at their pace and engaging in that conversation is very appropriate. When they get a little bit older, in terms of older teens, what we are doing in prevention a lot is the peer-to-peer model, is because our data tells us that youth are more likely, about 70% are going to go to their peer before they go to an adult. including their counselors or parents, which is about 60, 62%, 70% go to a peer. So how do you raise the capacity, the knowledge base of these youth and peers, not to train them as clinicians, but to help them to at least engage in that moment, to see the signs and symptoms of mental health, and to help link their peers to professional services. And that is really the leading front right now in terms of mental health and suicide prevention with youth, is to have the peer-to-peer model, so training their capacity to engage.
Before we go to Q&A, I just want to quickly go down the line. So if we can leave the audience with one thing that you think is really important when it comes to this topic that you want them to hold tightly, and then you can come speak with us afterwards about this in more detail. So we're gonna actually start down there with Melly.
The one message I would like for our audience members to take away is that you can overcome a mental health condition and lead any kind of life that you'd like.
I think that just for people to realize that it's so common, and if it's 1 in 5, it's how many people in this room, or at least if it's a person, if it's not the person, it's someone that they know, a friend or a family member, and that it's quote unquote actually normal to have a mental health or substance use condition.
Yeah, I also wanted to say that it's important that everybody understand that mental health conditions are manageable, are treatable, just as any other medical condition is. And so the stigma that surrounds mental health diagnoses is really, in my opinion, it's unfounded.
I just want to say that even if your situation feels really complicated, maybe there's some substance abuse, things like that, that it's not, you can definitely still get help. It's not too complicated. We can help with any number of issues.
For me, it's tell the stories, ask the questions.
I would say that it's never too early to talk to kids about mental health wellness, and how to take care of themselves, and to promote kids talking to other kids, trusted adults, about what's going on with them, and promote kids asking for help, and then being there to support them when they do.
I think for me, as we move and as we strive to move towards a healing community, that I think to have a good dose of empathy in all of us, to be aware of those that are around us, and to reach out and ask, are you okay? To move away from the medical model perhaps sometimes, and to look at the underlying needs. When you see someone in crisis or struggling, there's hurt. That's the underlying needs is hurt. And instead of asking what's wrong with you, you would want to ask, from a trauma-informed way, what happened to you, meaning that trauma impacts all of us, and that trauma leading back to adverse childhood experience, that it leaves you to possible long-term impact on wellness, physical health, wellness, medical wellness. But there's the idea of resiliency as well that is in all of us. And you said resiliency is the ability to bounce back from stress and from trauma. And we all have resiliency in all of us. And to help each of us identify what that is, and to help us foster resiliency in our lives so that we mitigate the impact of trauma in our lives and in our community.
Thank you. Just from the librarian perspective, I am not a clinician. As Diane said, we're not diagnosticians. We touched briefly on social determinants of health and how your environment, housing, education levels all affect your well-being. But one of the major predictors of optimal outcomes is health literacy. Just knowing how to ask the questions that get you the best treatment. And I'm really thankful that we had a panel of experts who can be with you guys tonight and are able to answer some questions. So we have some questions formulated. They're coming shortly. I think we're working on some handwriting. So I have a couple questions while we're waiting for a second. This was something that we had talked about briefly. It can be very draining and traumatic to support someone who seems to have a mental health problem. If a friend continues to lean on you for support, but they rebuff suggestions to seek professional help, is it better to continue to let them lean on you, or better to step away, or something in between? I can't answer this one.
Okay, I guess I'll start then. That's a really good question and really difficult. I mean, I think many of us have been in that situation for sure, when we have a loved one who clearly is struggling, but may be reluctant to share that with other people, perhaps other than you, or maybe a couple of people. I mean, I guess my general feeling is to try to take a middle path there, and to certainly be upfront about what your own personal limitations are in that situation, because it's really not, in the end, helpful to not be transparent about that, because it tends to lead to the person feeling betrayed or otherwise hurt. If you sort of follow a path where you're trying to be supportive and then you kind of break away abruptly, that can be very hurtful and feel like a betrayal. So that, to me, seems like not a great outcome. But I think taking a middle path where you continue to express concern and at the same time take care of yourself in terms of protecting kind of what you can manage and what you cannot manage, and what you think really kind of extends beyond your area of expertise in terms of where you think the additional support might lie. So for me, it's somewhere in the middle.
All right, we have questions. So one of the things we're talking about throughout this conversation is that the importance of open communication when it's talking about mental health. Like, the more we talk about it, the more we can be understanding and empathetic. But here's a question. In the area of government work, for example, can you still get security clearance if you've been diagnosed? Or what can you disclose? What can you disclose to a superior when applying for a job, within the job? Where does that barrier exist, or does it exist at all?
This is not my area of expertise at all. I mean, I have seen clients with government employment experience, or who need clearance, or so I know that it's something that clearly people pay attention to. And there are certain conditions that are flagged more than others. But I think that would be something that the individual would need to investigate fully with somebody who's more of an expert than I am. It would be hard for me to give any advice in that area.
All right, here's a very important question. So each mental health professional here has their own area of focus and expertise. What tools are available to help someone that would like to speak to a specialist but wants to narrow down the list of names? Tools that help them easily identify someone that would meet their unique needs.
I think when you're looking for a mental health professional, a therapist, it's always good to ask questions, and as the therapist is making an assessment of your needs, you can also be making an assessment to determine if it's a good fit. So do they come from a philosophy that you agree with? Do they have hours that fit your schedule? Do they practice in an area that you feel like would best address your needs? And then relationship is really important, and connection. So I found that it's important that clients feel like they can have a connection with the person that's going to be helping them.
Yeah, just to add on to what Jamie just said, I mean, I think what's been demonstrated to be one of the best predictors of a positive outcome in a therapy relationship is the engagement, is the nature of that therapeutic relationship. One of the just practical thing that I would suggest if somebody isn't interested in coming to a county government for services, there are a couple of online resources that people can look at. Psychology Today is one of them. ZocDoc, ZocDoc is another one, which are basically online search engines where you can filter for lots of different things, location, insurance, expertise, to try to kind of hone down on areas that are important to you. It's not perfect, obviously, and there's still a lot of investigation. And as Jamie said, I think some in-person kind of assessment would need to be done anyway, but it might help filter down a list of lots of people to at least something that you know is more within reach.
So we have two more questions. The first one is, why did you choose the title for tonight's talk? I actually chose that. I thought it was catchy. But more importantly than that, what we're really here to talk about is this continuum of care, and that it's an iterative process. So when you sing the ABC song, you always go back to start again. And we touched briefly on the continuum of care. I mean, we've expressed what it is, but if we could have someone like sort of speak to it in a little bit more detail, define what it means.
So we worked with Alex and Lynn in developing this presentation today. And one of the things that, from my experience, is that to frame mental health in a positive way, because when you say a mental health disorder, people kind of step back and they're like, ooh, and there's so much stigma attached to that. And so framing it in a way, and which is why we came up with mental health wellness, because we all have mental health, and it is a continuum, and it's how we are impacted by our mental health every day. And so we want to focus on the wellness as opposed to anything negative.
All right, we're going to conclude with one more question. And don't worry, if you still have further questions, we'll be available after this evening's talk to speak further. How do you know when someone is in need of medical professional help as opposed to just being in a funk? And what does being in a funk mean?
That's a really good question. And for children and adolescents, it's kind of being in a funk can describe adolescents. They're moody, they're oppositional, they talk back, they break rules. And a lot of that limit testing is really developmentally appropriate. So it can be really difficult for kids themselves to determine that this is a little more than just being a teen or being a kid, and for their parents, and for those that are around them. I would say one way to determine is this something that is persistent, so lasting longer than a few weeks? Does it happen in all settings? So something that is more of a mental health challenge would be something that's present at school, at home, in community interactions. And then, is there a change in behavior? Are they no longer interested in things that they were previously interested in? Or are they really interested in things that they didn't used to be interested in? Sleeping, eating. And in children and adolescents, mental health symptoms can look a lot different than they do in young adults, 18 and older. So depression and anxiety in children can look like anger, frustration, irritability, difficulty focusing, paying attention. So and then their age kind of comes in there. So I would really go with persistence, how long it's lasting, and is it present in multiple environments.
Can we touch briefly on seniors? So if you're suffering from other physical breakdowns atop of mental health issues. How does one handle that situation?
As far as you're saying, to determine whether it's just sort of you're in a funk or there's a bigger issue going on? Yeah, so for seniors, again, it would be just the duration, the severity, how it impacts functioning. Are they able to care for themselves anymore? Are they confused, disoriented? Are there any serious safety issues going on? Would be kind of an indicator that it's not just a funk, so to speak, but there may be a more serious issue going on that needs to be addressed.
Well, I just want to thank our panelists one more time. I think this was a really excellent first conversation. I mean, the important thing about these conversations is that this isn't the end. While this might be the end of our program, we're going to have some closing remarks in a second. These conversations continue. I would recommend that everyone check out our upcoming events at the library, check out DHS. These conversations happen throughout our community, and we're trying to reach you where you are, so you don't necessarily have to come down to Central. We can come to you when appropriate. So it is my privilege now to introduce Deborah Warren, Deputy Director of Arlington's Department of Human Services, for closing remarks. Thank you, Deborah.
Well, I'm so happy to see you all, and it's really an honor and a privilege to be here tonight. I took a lot of notes listening to this panel. Boy, you guys are just awesome, and I really appreciate the attention paid to mental wellness across the lifespan, right? Because that's just absolutely critical to families. And I know that, one of the themes that we heard is that mental health conditions impact all of us. It's 1 in 5. And it has a tremendous impact on the ones that we love, on families. And so that was a really important point. I want to really thank Melly here and also NAMI and the training that you received, because I think that is a really valuable service to hear the voices of the lived experience, and that's a tremendous service. And NAMI as an organization really worth supporting. And one of the things that, there were many things that really touched me, but I wanted to just highlight a couple of things that Melly brought out. And really, I think the theme of recovery is possible, and that despite having been diagnosed with a mental health condition, that you can overcome that, you can recover, which is not to say that you're cured. I think the theme we kind of heard is that that these are chronic conditions that can be managed with appropriate treatment. We also heard that finding appropriate treatment and the right mix can be a sort of start-stop process, and that it takes time potentially to settle on the right medication if that's the appropriate treatment for you. And that, as John was saying, that connecting to a treatment provider, the engagement with a treatment provider is an important indication of success, and also may take some time to find that right fit. It's also a complex system of care, and hard to navigate. It's hard to figure out the match between what your particular issue is and who can help you with that. Also timing and when people are ready to reach out and accept the help. So I think there's a lot of issues to this, and I think being able to talk openly and honestly and to do that level of sharing that we heard tonight is incredibly valuable. And I think that being able to sort of promote the resources that we have is really critical. You all in the audience can assist us with spreading the word that there is help and there is hope. And I think those are just the two things that I really want you to take away tonight. There's help and there's hope. And here in Arlington, we are really blessed with very strong financial support from the county board to provide services to the most vulnerable. And we are also available to help anybody locate the services that they need. So we were very lucky to get such a richness in terms of the points that the panel made, and I wrote a lot of notes here that I'm taking for myself, but they left you with one thing each, and one of the things that I really want to for you to take away is that people with mental health conditions want, and I think you said it, Melly, or maybe it was Lisbeth. It was Lisbeth said that people with mental health conditions want what everybody wants, which is a home, a sense of purpose, work, and to be connected, to be loved. And I think it was Lynn that said that one of the ways that we can help is to be a part of a healing community. So I want to thank you all for being here tonight and being open and listening. We are very interested in continuing our partnership with the library, and I want to give a shout out to Alex, thank you, and Alex's sister. And Alex's sister for being, a caregiver when you needed it the most. And I think, when we've had the opportunity to reach out and support somebody in need like that, it is also a gift to ourselves. The library has hosted a number of events that are related to this topic. Just a few weeks ago, we had an event where we focused on youth, anxiety in youth, and I see Carla there, she was on the panel, and we had the movie Angst, which is excellent. You can get that online, about a 45-minute documentary. We also had Beth Macy come last year and really talk about her research and work on her. She wrote a book called Dope Sick about the opioid crisis, which she had been following since really it began in the Roanoke area. And we are very interested in continuing this work with the library around educating and creating a forum for this open dialogue. So if you have ideas or topics, presenters, authors related to substance use disorders, mental health, developmental disabilities, we would be very open, or a combination, we'd be very open to working on that and putting together a program that would be meaningful and helpful to the community. So last round of applause for our panel. Thank you so much. You guys did great.